much different like that. There are different types of plasma. There's PRP, which is plasma-rich platelets. There's plasma pool platelets. So we have to understand what's different terms so we can get the right message. So PRPs is a sequestered and concentrated platelets and white blood cells in suspended plasma. Definition of PRP, so the normal platelets count in the blood is usually range between 150 up to 450 platelets in cubic millimeter. So to get PRP, we have to get like 4 to 6 the baseline. And the second point, an important point, that we should have like a dual spin processing system like that. Because now in the Europe, North America, and here as well, many people are using plasma, but it's not really PRP. To get PRP, you should have dual spin. What's meant by dual spin? You can have like a soft spin and a hard spin. So the soft spin is usually at 2,600 PRM. And the purpose of the soft spin is to separate the RBCs from the plasma. And later on, you get the hard spin, where you'll be able to separate the platelets and you get the PRP. It's important to get an anticoagulant like ACDA. And PRP usually contains concentrated white blood cells to counteract infection. So let's take a look at the mechanism of PRP. So PRP for stem regeneration therapy uses components called platelets, as we all know. And platelets have growth factors. And these growth factors usually modulate the immune response and the different metabolic pathways in human bodies to induce collagen production, generation of new capillaries, and rejuvenation of skin. Moreover, white blood cells exert a synergistic effect, resulting in about 5-fold increase in the amount of growth factor released. And in premium PRP skin regeneration, the growth factors cocktail is supplemented with specific growth factors injected to ameliorate skin problems. So what are the different growth factors? We have the PDGF, or platelet-derived growth factor, which promotes cell growth, new generation and repair of blood vessels and collagen production. We have also the FGF, or the fibroblast growth factors, which promote tissue repair, cell growth, collagen production, and hyaluronic acid production. Another growth factor is the vascular endothelial growth factor, which promotes growth and new generation of vascular endothelial cells. Epithelial growth factors promote epithelial cell growth, angiogenesis, promotion of wound healing. Tumor growth factor beta, which promotes growth and new genesis of epithelial cells, and vascular endothelial cell promotion for wound healing. So the efficacy of PRP. So we can use PRP in cosmetics or plastic surgery to augment and improve the nasolabial roof, to get rid of fine wrinkles around the eyes and wrinkles on the forehead, wrinkles on the neck, wrinkles on the lips. It can improve acne marks as well, and sag and dark circles under the eyes. We look at anti-aging, wound healing, and plastic surgery applications of PRP. Usually for wound healing, reduce seroma and hematoma formation. It reduces inflammation. It promotes wound healing and shorten the period of wound healing. As we all know, wound healing passes into stages. The first stage is hemostasis, followed by proliferation and collagen synthesis and remodeling. And with PRP, you can really shorten this phase. It can reduce scarring, it can reduce pain, counteract infection. It can be like a skin rejuvenation modality and somehow filling It can be used for hair restoration. My own experience started back in 2005 in Europe. I have like total of 459 patients treated in Europe, North America, and Saudi Arabia. This is an example of not just PRP. This is an example of like a combination of therapy and cosmetic or aesthetic surgery. Like PRP by itself is not a treatment or a cure of skin problems or any beauty problems we're facing in our clinic. Like this patient, usually if you can see the mark in front of the ear, you would say that, or you can tell that she had like a facelift with her preocular incision. But she had as well fat grafting combined with PRP. And you can tell the augmentation of the cheek, of the nasolabial fold, and the better skin texture after these combination therapy. So just 1 week after, so it's a remarkable result. You can take a look here at the nasolabial groove and the marionette lines in a 72-year-old lady. So the picture on your left shows that just before the injection, and the one on the right just 2 months later, which marked improvement. In the nasolabial groove, you can see just before injection with marked lines, and 2 weeks later, it's almost like a filler, as you are using like hyaluronic acid or any other calcium hydroxide type filler.
Here, this combination fat and plasma, or it's only plasma?
This patient,
It's only plasma?
just here.
Only plasma.
Actually, you have to differentiate and you have to be very precise with your terms. So plasma is something and PRP is something else. Okay? So anything just below 900,000 platelets per cubic millimeter is plasma or plasma pool platelets. So to get PRP, you should have like more than 900,000 platelets in 1 cubic millimeter. So if you have less than 900,000, this is not PRP. Okay? You can take a look here at the wrinkles and dark circles around the eyes. The picture on the left just before injection. You can see those sacs, depression, and just 2 weeks later. You can see the sacs under the eye. This is 60-year-old gentleman just before injection and just 1 month after. Another example of the nasolabial fold and wrinkles under the eyes of 72-year-old woman just before injection and 2 months later on. So what about PRP in real life? So PRP enrichment is increased the cellular survival and the proliferative potential of cells. And if you combine it with fat grafting, it will actually give fat survival. Platelet-rich plasma actively mixed with 1 ml of centrifuged fat tissue for reconstructing the 3-dimensional projection of the face to restoring the superficial density of facial tissues, and it usually gives remarkable results and usually long lasting. And these results were obtained have proven its efficacy of these combined treatments. This is the study I made like in 2007 in the Anne Plastique, the French analog of the American Academy of Plastic Surgery. And as we know, like fat, if you're injecting fat in the body, you have to know in the first 6 months you have a resorption from 20 up to 50% of the fat being resorbed in the first 6 months. But if you combine PRP plus fat, you can reduce this amount of resorption up to 10%. So there's a remarkable difference between just fat injection alone and fat injection combined with PRP. Regarding the outcomes, PRP has proven its efficacy in infection reduction for treatment of chronic wounds. It enhances the recovery. It reduces the surgical intervention and subsequent surgical intervention, debridement, and so forth. It reduces the office and physician visits. It shortens treatment regimen, and other post-operative complications are reduced. In North America and Europe, they use different centrifugers. Like here in Saudi Arabia, we have different centrifugers. And this is an example of a centrifuger. I have no conflict of interest with this company, it's Magellan. It's an American FDA approved. But just to give you an idea how this works, so usually you have a custom designed syringe which pumps for accurate delivery with minimal cell activation. You just put it in the chamber here, okay? And this is the one here on your left. This is a tube, which is a closed system. To reduce the possibility of contamination, would you be able to separate PRP? So out of this like 60 ml syringe, you'll get around 10 mL of PRP. And you have different sensors which shows you like the different stages of the centrifugation process. There's a prime phase, the collecting, processing, and emptying phase. So it all will show up on this display. So it's very automatic. The moment you just put this syringe, so everything just works. So you don't have to do anything. It's usually like minutes and it's done. Fat is different.
For the hair and for the face, is there any maintenance sessions?
It's usually, this is recommended by the different studies published in PRS and the annals. It's usually 3 sessions for the face and 6 for the hair. You can add up like for patient satisfaction. The patient wants like a better, feel.
And after that, you can recommend one session.
Yeah, during 1 year you can like add 1 to 2.
At the site of injection, it's intradermal, subcutaneous.
Well, it depends. Like you are going for a hair restoration. So if you are going for hair restoration, you have to understand and to analyze the skin. So you would tell that the hair follicles lies in the reticular dermis, and so your injection has to be in the dermis. There is no point of injecting in the epidermis or injecting in the subcutaneous.
So intradermal.
Yeah. So
and for the hand space,
you can do both epi and dermal. For fat, you inject in the subcutaneous tissue and intramuscular as well.
So your instruments is that device for separation?
In the video I showed you, my video, it was like this centrifuger. But as I told you, the take-home message is to understand there's a difference between plasma and PRP. So plasma is plasma. PRP means plasma-rich platelets. So if you are someone saying that I tried PRP and didn't work, that means he didn't try it the proper way. So anything less than 900,000 platelets per cubic millimeter, this is plasma. Yeah. So this is plasma core platelets.
So it is
this is one thing. This is one thing. This is take-home message number 1.
Yeah.
Number 2, you have to understand the principle of dual spin centrifugation. So you have the first spin, which is the soft spin, has 2,600 PRM. This is to separate RBC from the plasma. So then you have the second one to get your platelets.
So it is a special device?
No, it's your centrifugation. I mean, yeah, your technique. I mean, the centrifuger you have. You should be able to do both, Any further questions? Thank you very much.